Hi, this is my practice speech for my oral interpersonal communication speech. It's on the topic of VBAC, is it possible? And VBAC is an acronym. It stands for vaginal birth after cesarean section. It used to be said once a C-section, always a C-section, but now those rules are kind of changing a bit. With the C-section rate around 32.3% in the U.S., according to the CDC, which is the Centers for Disease Control. Having a vaginal birth after C-section is a growing trend that we're seeing more and more. But is it safe? Healthy People 2020's goal for VBAC is that at least 18% of births would be a VBAC, and but we are well under that target goal according to the U.S. Department of Health and Human Services. We all know somebody that's had a C-section, and if they want additional kids, they also might want to avoid additional surgeries, abdominal surgeries. Recovery from abdominal surgery is much harder than recovery from vaginal birth, typically. It also can really affect things like breastfeeding and bonding. So how can we be sure to keep the birthing population safe while also limiting additional surgeries? The way we can do that is vaginal birth after C-section is an option. Being a healthcare provider, we're always walking a teetering balance beam between the safety of our patients and their babies, also considering their desires and wishes, the way surgery affects future fertility and birth, recovery time, and how surgery is going to affect breastfeeding, etc. We know the latest stats say 13.3% of people who have C-sections go on to have a successful VBAC. So that's the good news. It's very possible. The biggest risk we worry about with VBAC is the risk of uterine rupture. While it is a statistically very small risk, somewhere between 0.3% to 1%, according to ACOG, which is American College of Obstetricians and Gynecology, those results are catastrophic if they do happen. It often involves the death of either the mother, the baby, or both, because the rupture leads to hemorrhage, often while the baby's still inside the mom and still dependent upon her for oxygen. So there is no good way to really predict who might have a rupture or not. The type of C-section that was performed is the first thing we take into consideration about whether or not that is more likely to happen. Also, the number of C-sections a person's had, other abdominal surgeries, the scar tissue itself, whether it healed quickly, with or without infection, and other incidents, the reason for previous C-section or C-sections are other things that are all taken into consideration when a provider is considering whether someone is safe for a VBAC or not. And the most important thing that I hope you take away from this whole thing is, if you are looking into a VBAC, I think the most important aspect is considering who your provider is going to be. You can ask providers straight up whether they support VBACs or not, and if they do or don't, that will tell you whether you want to work with them. Also ask them, how many VBACs they have worked with previously and how successful those VBACs have been. I think that is the most important takeaway, is that you're going to want a provider that will be willing to work with you, and that provider will then go forward with steps on how to help you have a successful VBAC. Thanks.